because you've been reported as saying that you find the pandemic response poor. Can you be more specific about
yes,
or inadequate?
poor.
So,
No, yeah.
Can you be more specific about it?
Okay, no, I was saying that there was a lack of a sense of urgency. It was basically that at the start, and this is from the very beginning. You have to remember that it was March 2020. We also found out that there was no reporting, or there was a lack of transparency. We were not told that there was already community transmission when there were already COVID patients in the hospitals or in ICUs. We didn't know, the doctors. We were sitting ducks. Because many doctors died early on. That's one. There's lack of transparency. Two is they did not close borders as soon as they should have. There was a slow response. No, they were still thinking of hurting the feelings of China. Three, we were not ready with the testing. We had, there was like so lackadaisical. Oh, we have 2,000 test kits. That should be enough. It was not enough. People were dying before they even knew if they had COVID. So there was a lack of urgency, no? And to the point that the private sector, it's a good thing the private sector was there, and the doctors in both public and government hospitals, kami na nagre-raise ng funds. We were the ones raising funds to get the PPEs, etc., etc. So we were like scrambling. So we felt there was a lack of a sense of urgency. Then the vaccines. Okay, the vaccines, we could have got them earlier, and I think it's been talked about, dropping the ball, etc. No, and then overpricing. I know for a fact things were overpriced. Even the testing was overpriced, and if it were not for the pagkakulit ng private sector, the PCR test would be 8,500 pa bawat test, and it went down and went down. So my point is, and then the vaccines, the price of the vaccines. Until now, this is November 3, 2021, we still don't know how much government paid for the Sinovac vaccine. So lack of transparency. So when you have that, there's a lack of trust.
Okay.
And when there's a lack of trust, you have a problem, even with implementing vaccination. So that's sunod-sunod.
Dr. Padilla, we will get into all of those details, but let's just signal it very clearly. We're now asking you as somebody who's running for the Senate.
Okay.
Well, let's start with that. Why? I mean, you obviously.
Why
run for the Senate? I mean, I mean, in this past 1.5 years, we could sense naman you're very open about your frustration, your questions, and so on. But why run for the Senate? How much of a difference do you think that makes?
Okay. Well, okay. If you were to ask me, I would probably make a bigger difference if I were Secretary of Health, because you could really do something. But then again, you depend on the president. How do you know the president will want you to be Secretary of Health, or you even have the same ideals, the same passion for, the same political will? So the Senate, okay, I have been an advocate for health for the past maybe 26 years, 27 years. And I've been working with senators, with congressmen, and we advocate. We tell them everything we feel has to be done. But at the end of the day, it's still up to them. And many times it can be frustrating, okay? We see a lot of the laws that we helped to pass through our technical working groups, etc., not being implemented properly, and yet there's no oversight. Nobody's telling them, "Oy, mali yan." But we doctors, we live through it. No? I work in Philippine General Hospital. I cater to even the poorest of the poor and the most desperate. I also work in a private hospital, St. Luke's. I see the extremes. Okay, I teach also in UP. We see the patient's needs. We see how the laws affect us. If you are just making the laws and you don't live in the trenches the way we do, it's hard to really understand how your laws affect us and what needs to be fixed. And we know which are being implemented properly and which are not. And so and then I've been in PhilHealth. I worked in PhilHealth 1.5 years, the latter part of the Aquino administration. And we tried to effect a lot of reforms, and we did. But there's so much that has to be done in PhilHealth. And look what's happening now. They're not paying the hospitals. We know, I kind of know how to solve many problems. But if I'm just an advocate, I don't have much of a voice. But if I'm in the Senate, I will have the floor. I can have more influence, maybe.
Could I start with one example that you cited? High prices of testing kits, high prices of vaccines, overpricing. Let's throw Pharmally in there and the face mask. With your decades of experience, is that a problem just now, or has that all, is that a chronic problem in our public health environment?
I believe there's overpricing. It's a chronic problem in the Department of Health, and I'm very sorry to say this now, but there have been so many how do you say this, anomalies or things that are not really run the way they should. Even in the supply chain management, there's very so much to be desired. Why buy expiring medicines at regular price when they should be 30% off? Things like that, no? And we hear about it, but we're not in there. We can't really do anything about it. Now, this Pharmaly thing, what makes this extremely horrible, no, is the fact that it happened during a pandemic when people were dying. There was desperation among the people. People were suffering. And that's why it's extremely painful, no, for the healthcare workers and even for the patients themselves. You know, corruption has been happening in every administration. But parang to see it happening this way, no? Yung garapalan talaga, yung pagpapayaman, as they say, no? Habang nagdurusa yung karamihan, it's like you wonder what kind of souls they have. Because and then we were there scrambling for PPEs, using garbage bags, while all these deals were going on. And there were delays. Why were there delays? And I can tell you, there was a tug of war between those in government who were earnestly doing their job and those who were trying to make a profit. So I'm sure there was some form of overpricing happening. I don't have all the data, but this time I know there was. And it was a time of desperation. That's why this is what makes it extremely, difficult for us to take. And we cannot ignore. And maybe because we've turned our backs too long, we turned a blind eye too long on corruption, parang it became, commonplace, just how it's done, and with more impunity. No? Parang, I see, okay lang. So it became commonplace, even in the time of suffering and in the time of pandemic.